I also want to show you now one other thing that we've been working on in the lab for cold pain. What I do have, and I can tell you how you can do this in clinic. Right now I've got a bunch of different cylinders that all look the same, but they're all made of different materials. And so when I cool them to the same level, which is happening right now, they're getting cooled down, they feel differently when I put them on somebody's skin. Okay, so some feel colder, some feel warmer, just based on the thermal properties of the materials. I started doing this just using big construction nails in the clinic that had the pointy ends lopped off. Okay, and just would I wrap the ends in like electrical tape so I could hold onto them, and I stored them in the freezer in the clinic. So I've got something there. I had two big metal nails. And when I could take them out, and I wanted to try and get just a really rudimentary assessment of cold sensitivity. This is also something, cold sensitivity appears to be highly indicative of neuropathic pain problems. And it may also have some prognostic value. To this point, however, it really hasn't been used routinely in clinic, again, because the TSA2 neurosensory analyzer, which is sort of the gold standard for cold pain threshold, is going to run around $20,000 to $25,000, depending on how many bells and whistles you want to get on it. So this is my, like, poor man's way of trying to do a little bit of cold sensitivity testing in the clinic. If you flip over the page from the pain threshold scales there, you'll see a cold sensitivity scale. What that basically is, if you look at it, is really two 0 to 10 numeric rating scales popped on top of one another. The first 10 levels say that this is cold, but it's not terribly painful. The second 10 levels say this is cold and it's becoming painful. I can tell you from my mercifully short-lived experience with shingles about 3 years ago that just putting my clothes on in the morning that were sort of room temperature was uncomfortable. They were uncomfortably cold. So a quick and simple sort of application of a cold stimulus that maybe isn't normally painful to a healthy, well-functioning nervous system could be experienced or perceived as exquisitely painful to somebody with a neuropathic pain problem. And while this is cooling down, I'll just show you the results of some work we've been doing with this recently. This was one of my, my research groups from last year. Did some of this work on their classmates and some people with CRPS, complex regional pain syndrome. I'll show you this one first. What they did here is they used 3 different of these materials. Like I say, I've got 5 different materials in here. They used 3 of them, the coldest, the warmest, and then one sort of in the middle, and did this pain rating thing. So they applied them to the skin of the person for a 5-second period and asked them to provide a pain rating. In the normal healthy controls, and now there's actually about 40 people that we've done this for 2 years now. In normal healthy controls, you can see that really these are the mean values. People aren't generally rating even the coldest one as painfully cold. There were 2 or 3 of those people out of 40 who rated it an 11 or 12. I think the highest rating we got on that one was 13. Okay? And then we've got a couple of people over here who have well-known raging CRPS, complex regional pain syndrome, which is a neuropathic pain condition. And you can clearly see that in all 3 of the materials, they're rating them high, and starting from the second one, they're rating them into that sort of painful range. Okay? So this may be a tool, something that you can indicate that might show you some pain sensitivity. I will tell you here, this is not like a dramatic secret. It's not like in the Pulp Fiction suitcase or anything like that. All I've got in here is I've got a cooling plate. It's called a Peltier cooler, so it's an electric cooling plate. I plug it in. It cools down to 0 degrees Celsius. And then I can take one of these ones. I know which one's the coldest one. And I'll put it on the skin from the back of the hand, hold it there for 5 seconds, and then ask them to look at that form and tell me how that feels. Okay? Fairly simple. We can do it bilaterally. We can do it on each side. I can, again, do it distally if I wanted to. Okay? I can do this over the neck. There are other ways of going about this. Some people will have heard of something called a cold presser task, which is where you ask the patient to stick their hand in a bucket of water, of ice water, and see how long they can leave it in before they take it out. That's another indication of cold sensitivity. The problem there is that it's really limited to hands or feet. You can't have somebody stick their head in a bucket of water. Everybody comes out after 30 seconds. So that's one tool you can use, but I'm going to take this one step further here because I really love you all, and I want to show you something that I think is kind of cool. Some of you will recognize this as a iPod Touch. This little handy little device, without the Q-tips, which doesn't come with, these were a custom edition afterwards, is called a node. This comes from a company called Variable Tech. Again, I have no relationship with the Variable Tech folks. The node, the base node itself, is a 9-degree of freedom motion sensor, which means you can jiggle it around. It has a free app, and you can sort of see what happens as this thing moves around. We are using that function in a different way to try and evaluate dynamic neck motion. Okay? But you can buy these additional little modules for it. And this one is a contactless infrared thermometer. Okay, so this one's an infrared thermometer, so if you, I'm not sure if you guys can see this. Right now it's streaming. I'll do this. Here we go. So if I was to check the temperature of my head, here we go. Where am I? 35 degrees. I might be dying. Either that or it's ripping hot here. Okay, so you can check the temperature on different things. My shirt, this chair. Okay. So it'll, in real time, it'll do this. The neat thing about this as well is that in real time, it will store these data, which you may or may not find interesting, but from a research perspective, I find really interesting. I won't pick on Eric again. Can I have, is somebody else willing to come up here and just be like a quick volunteer for me? Good, good. Come on up.
Hi, Mom.
What I'm going to do, I'm going to take and apply this for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take it away. And then watch this. Now it should be slowly increasing. Yep. Is it? Yep. Okay. So hopefully you can see that. If you think about what's happening here, I don't know what the temperature is in this room right now. It feels like it's ripping hot, but I don't know. Maybe that's just because I've been talking all morning. But let's say it's 24 degrees Celsius. But it's when his skin starts to rewarm, ambient temperature is going to bring us up to about 24. But after that, it necessarily has to be occurring internally, right? It has to be driven internally. So you think of what's happening here, your little capillaries are dilating, it's trying to bring more heat to the area by increasing blood flow. This is an autonomic response, right? This has to be an autonomic response. So what I can do here is I can get a sense of what's happening in his autonomic nervous system, right? Nice. Appreciate it. All right. Thanks, guys. Again, doing a little bit of work with this that we've done to this point, and I'm hesitant to say that this is necessarily ready for prime time yet, but I'll give you a sense of what we've been doing. Here again, we have our 40 or so healthy folks, and everybody rewarms in a fairly consistent manner. Okay? Now that said, there are some side-to-side differences in some people. Okay? If I come down here, I've got, again, here's a patient with a well-known CRPS. The affected side is this one that's darker blue. It's this one that starts lower here. One thing you can see clearly here, and I've done this actually on this particular patient several times. He's actually a patient of mine. And this happens every time. The affected hand warms dramatically quicker than the unaffected hand. And I've started to see this now in other patients as well with CRPS, just not as quite as dramatically as this one. We've done this several times now, and it happens every time. So we may actually be getting to the point, and again, I'm being cautious here, that this may not be ready for prime time, but I've certainly been using this. We may be getting to the point where we can actually have a clinical test of essentially autonomic reactivity to cold. Going back to that radar plot, once again, I'm trying to figure out what domains seem to be problematic in this patient. If I'm seeing something that would suggest to me some dramatic kind of weird autonomic reaction to this, again, this is probably not the person I'm going to go and start banging away at until we figure out what's happening with them. So these are all just different tools you can use. The node itself, the base node, is $99. I think it's amazing that she can get for $99. Actually, I've become a bit of an evangelist lately because I think it's really quite interesting. And all the different modules, they're really cool. Like I said, I have no relationship whatsoever. I also like gadgets, so maybe